Meconium in labor. So what is it? Meconium is your baby's first poo. Most babies will pass this poo at birth, but some babies pass it in utero, so whilst in the womb. And the only way we know is if and when your waters break. If it's a yellowy, greeny, browny color, then that's the reason. So babies passing a poo in utero can happen for two main reasons. It could be a case where you're overdue. So your baby is mature, his bowels is mature and ready for birth. And it could also be some sort of sign of fetal distress. When we see meconium, it doesn't necessarily mean there's a serious problem, but it does mean we need to keep a closer eye on your baby and how your labor is progressing. This does mean you need continuous monitoring of your baby's heartbeat during labor. So unfortunately, this does mean that if you were low risk, for example, on the birth center and having intermittent auscultation, you'll now be encouraged to move down to the labor ward where we can strap you to a monitor and have a visual tracing of your baby's heartbeat throughout your labor. It also means you have frequent observations during your labor, paying close attention to your temperature, and also means that your baby will need specific observations once it's born within the first 12 to 24 hours of birth. A pediatrician, so a baby doctor, will also be present at your birth. Now, all this extra monitoring is to ensure that we pick up the babies who need extra monitoring very early with early intervention. Now, this is because of the risk of meconium aspiration syndrome, and this is where some babies may potentially breathe in meconium into their lungs, therefore putting them at risk of complications. The good news is with meconium in labor, you can still have a normal vaginal birth and a healthy baby at the end of it all with the right management and support. Now, I've got great educational content to help you along your pregnancy journey. So check out my page and follow for more. Just do me at Simply Pidgey.